Watch this.
Genomic sequencing. Yeah, you might be able to say it, but can you describe it? We're going to try because it helps us understand how viruses like COVID mutate. It's a laborious process being done in an Idaho lab. They say a simple gesture of thanks goes a long way. So how far would hundreds of them go? We've been over the tie or no tie thing, but today we're going to tackle an even bigger clothing discussion. What about what our female colleagues wear? The Omicron variant of COVID-19 was discovered in South Africa on November 24th. Days later, on December 1st, found in the United States. By December 23rd, it was confirmed in Idaho and now accounts for 98% of all COVID infections in the Treasure Valley. And we're already seeing the next version work its way around with the subvariant of Omicron, confirmed in Ada County last Friday. It's a lot of moving parts with which our labs have to try to keep up. How do they do it? And how do we know what variant is circulating in our community? Katya Stepovic went to the lab to find out.
As of mid-January 2022, the state of Idaho has sequenced nearly 5,000 positive COVID samples to find certain variants, and the demand to sequence more is increasing. Dr. Christopher Ball, director of the Department of Health and Welfare's lab, says the lab has been doing whole genome sequencing for things like bacteria viruses that cause foodborne illnesses for several years. Then, at that time, the lab was processing maybe 16 samples every 2 weeks. That was the lab's capacity. But since then,
we're processing thousands of samples per week. We've completely built a new sequencing program from scratch.
If you would have asked me 3 years ago that I am where I am right now, I would not believe it.
Through federal funding, the lab has been able to build their program in order to meet demand.
The goal here is really to try to monitor how the virus is changing through time and to be on the lookout for new variants of concern.
The lab can start on roughly 300 samples a day. But the process can take days and includes 6 different steps. It starts out like this.
So once we receive all of those samples, the first step that we're going to do is to prepare those samples for extraction of the nucleic acid in the positive samples.
Basically, chemicals are put together so that they can purify a positive sample.
We take the sample that has the virus in it, and we separate all of the RNA and DNA out of that sample from everything else.
They separate and clean the DNA and RNA in order to create a high concentration of it, to get rid of any enzymes in the sample that could potentially create a false negative. They put that cleaning solution into 94 different tubes. That's as many as they can process at one time. Then it's time for step 2, adding to the positive sample, a step that must be done by hand.
Our staff have to be really focused because you've got 94 patient samples that you're trying to get into a precise location, and you've got to make sure that you're matching up the sample with the map, the plate map, so that we get the right sequence associated with the right patient.
Then the samples are put into this machine, which uses a magnetic method to separate the RNA and DNA from each sample. After that, the next step is to make thousands of copies of a single sample.
So that's what we're doing in this instrument, and it goes through a series of temperature steps that help the chemicals and enzymes in there make all of those copies of the genetic material.
And that alone takes several hours. After copies are made, each sample is given a barcode to be able to identify each sample and where it came from. Once they are labeled, they are loaded onto the sequencer, which makes a digital copy of each sample. This alone can take a full 24 hours. Once that's done, it's put into a database to determine what variant is present.
So this AY.25 is a Delta, this BA.1.1 is an Omicron, and that's how we...
Look at how many Omicron cases.
Yep, so it's almost exclusively Omicrons with a few Deltas mixed in.
The sequence information is then submitted to the state to report. Dr. Ball hopes it's that people understand how long the process of informing the public about circulating variants can take.
And I understand why people, they want to know the answer quickly. And I think that there's a misconception that it's an easy answer to get to.
But the process, as we know, takes multiple days, if not a week.
It's been really a challenge for us to balance workload and balance expectations to make sure that these hardworking state employees can continue to do the good work that they've been doing for 2 years and now going into the 3rd year.
2 years into it, it's very frustrating. I feel like for a lot of the time people referenced it as running a marathon, but we're at the point of when does the marathon actually end?
It is a great question. Now, the process is so intricate and detail-oriented, as we just saw, that some samples can be faulty. To this day, 1,108 samples did not sequence successfully, which is important for the public and our viewers to keep in mind, Brian, that there's potentially higher variant numbers than we're seeing being reported right now.
And these things move around the world in a matter of weeks, these variants. And so it's a marathon that never ends. Exactly. That seems to be the best description. All right, thank you very much, Katya. So when it comes to COVID-19 pandemic, we haven't been the ones to just throw numbers out to you on a daily basis here on the 208. We understand that could lead to a numbing of the message, as it were, especially when delivered without context. But over the last few months, when, as a news station, we have shared the number of positive COVID cases reported, it has come with this caveat of, but that doesn't include the number of positive cases waiting to be processed by local health districts. And this week, that number waiting to be processed jumped to 42,100 statewide, according to the Health and Welfare's website, making the data for the past 2 weeks incomplete, as they say, because of the surge in cases that we've seen, which has prompted several of you to ask, what does that mean? Like this text from Irene. On tomorrow's news, we got this yesterday, by the way, please explain what's involved in reviewing positive results by Health and Welfare. Thank you. Or this other COVID backlog question from Lee in Boise. How many are coming out of the total every day, and are those numbers backdated to the day of the test, or are they added to the total of the day they are verified? All good questions. First, Idaho Health and Welfare wanted to make it clear. These are not backlogged cases. They are outstanding lab reports. Let's start with Irene's ask first and explain the local public health district review process. So when a positive test is reported, staff at that respective health district must verify the person is an Idaho resident and also try to get in touch with them to do a case investigation and contact tracing, something that isn't being done as prevalent as it was back in the early days. Those investigations can take anywhere from a few minutes to 30 minutes to actually get a hold of someone, get the answers or the questions answered, and then enter all that data into the system. However, with the surge in cases, that can leave a lot on the table at the end of the day or even at the end of the week. For example, Central District Health, that's Ada County and Boise County, around this area here, they went from 700 to 800 positive cases per week in December to more than 6,000 positive cases the first week of January. They told us last fall they can only process about 600 a day. And according to Health and Welfare, one lab result is not equal to one case. That's the other part of this. About 5% of those positive results needing to be processed are coming from people who took multiple tests within 2 or 3 days of each other, we're told. Test result shopping, they call it. Sometimes getting a second test while waiting for the results from the first one. And if someone has a lab-confirmed PCR test, it's not counted as a new case if it was within 90 days of a previous positive test. So there's a lot of layers and elements to reviewing positive results by health districts, and you can see why they are days behind. From there, it goes to Health and Welfare, and the outstanding results are added to the dashboard, the daily counts, on the day they were submitted by the local health district, to answer Lee's question, not necessarily the day that person took a test or even got their positive result. So in short, there's a lot of questions and confirmations that need to happen before being officially reported to Health and Welfare, a process that could take anywhere from minutes to days, and then they are added to the daily total on the day that process is finished and reported to the state.
Well, I kind of want to say that God formed us with our faces and with our smiles and with the ability to communicate in that manner.
Representative Carrie Hanks from St. Anthony giving the old no government issued mask mandates another try. Speaking from the heart there, this time in the House State Affairs Committee, which gave the go-ahead on this getting a hearing. The point is to prevent the state of Idaho, a county, a city, a school district, any of those, any government entity, from issuing mask-wearing requirements to preventing or slowing the spread, to help prevent the spread, I should say, or the slowing of a disease. It's the exact same bill Hanks tried to get through last session, and it sailed through the House last year, but it died in the Senate Health and Welfare Committee. Speaking of demise,
should be optional. We have that bodily autonomy and that right. If people were dying in the streets and we felt that a mask would change that, then I believe that we would wear them.
If people were dying in the streets, literally collapsing on the sidewalk, I guess, is that now the pandemic point for preventative health measures? Well, no, people are not dying in the streets from COVID-19, but they are dying. Some at home, most at the hospital. Some even while waiting for admission to the hospital because there are so many COVID patients, there's not enough room in that hospital. And they are dying at alarming rates. 4,425 Idahoans, to be exact, 4 more added today. More than the population of St. Anthony, Representative Hanks, your hometown. And maybe if people were dying in the streets and we felt a mask could change that, then I believe we would wear them, she said. Well, the Idaho Department of Welfare, the Centers for Disease Control, a vast majority of doctors not only feel like masks prevent the spread of COVID, they have lots of scientific evidence to back them up. Yet only a handful of government entities in Idaho ever had a mask mandate, and very few still do. Are masks the be-all, end-all when it comes to this pandemic? No, because after all, we are still in crisis standards of care for several of Idaho health districts. The House State Affairs Committee unanimously agreed to give Representative Hanks' bill a hearing. It's tough being a teacher right now. Long hours, short-staffed, lots of accusations, and little thanks. But not in this central Idaho school district. They went grandiose on the gratitude. You know what takes just seconds and is super easy to do? Sending us a text message. We'll take your questions, your comments, and yeah, we'll even take your complaints, as long as they're all clean, clever, and concise. Our number, 208-321-5614. Don't forget to include your name and the hashtag, the 208. And stick around, because we're going to share as many as we can at the end of the show. Go. These days, seems a small gesture can go a pretty long way. Just ask frontline healthcare workers, grocery store staff, even teachers. And for teachers, the past 2 years have been interesting, to say the least. Sure, the early days of COVID, we saw a lot of thank yous and a lot of gratitude. These days, In the Wood River Valley, a group decided to rally behind their teachers, their faculty, and the rest of their school staff to make sure they know their work and their efforts are very valued and important. Joe Paris takes us to Blaine County, where the thanks are flowing strongly these days.
It's been a tough go for many since the COVID pandemic hit Idaho in March 2020. A lot has changed, especially in places like Idaho's public schools. For almost 2 years, COVID in schools has almost been a constant conversation. Back and forth between remote and in-person, it's been challenging for teachers, students, and all school staff.
We now have data that shows that attending school in person is best for students' mental health and their academic success. And so many people are out sick right now that schools across the state and the country are facing staffing shortages, and we're having the same problems.
Laura Stone is the vice chair for the Blaine County School District Board of Trustees. She says while reflecting on the incredible work of school district employees recently, she realized that she wanted to make a point to say thank you and share her gratitude.
They've had to temporarily shut schools down, and our staff are working so hard to follow our protocols and keep kids in school and provide them with the support they need. And I just couldn't figure out a way to extend a thank you to them other than, kind of one-on-one. And I thought, I bet there are a lot of other people in our community who also really appreciate the fact that our schools have stayed open so far.
So they started a campaign to say thanks, and quickly, notes like these started coming in from across Blaine County.
I thought the response was fantastic. It was everything that I had hoped. There are times when expressing gratitude is something that's healing as well as receiving that gratitude. And I think, just making it a real easy and safe way to provide, those kind of comments to people was really, really satisfying.
Teachers, support staff, administrators, assistants, you name a job, and this list almost certainly has a comment with high praise for them.
One of my favorites was to the bus drivers. One of the parents said that her son idolizes his bus driver, and the driver is always happy, kind, caring, and patient, and that her boys rush out the door every day to the bus stop to see him. One of them was, we've had a couple that said that the people writing them were tearing up as they wrote them. One said they were so grateful to our nurses for making their child feel safe and loved during this uncertain and trying time.
Stone says the responses from teachers and staff has been great. They have enjoyed and appreciated the messages across the Blaine County School District. It's also a reminder, small gestures of thanks or appreciation can go a long way, especially in times like these.
I just think it's so important, and I know students are really grateful to be in school right now. I hope this inspires more people to make an effort to reach out, even to just to a particular teacher or to a particular staff member, a bus driver, or a nurse, and thank them for their time.
And you may be interested, how did they actually deliver all those notes? Well, the dozens and dozens, well over 100 comments, those were all compiled actually, and they were sent out as PDFs to the teachers so they weren't overloaded with dozens and hundreds of emails. So the school district staff really made a concerted effort to make sure that all the teachers could see the thanks, all the faculty could see the thanks, all the way to the bus drivers, the lunchroom staff, everyone. So they're hoping this catches on in other school districts. We'll just have to wait and see. All right, new to the 208, or you've been with us since the beginning, we try to keep things casual here on the show.
easier to have a conversation. It started with the tone setter, the no tie thing, emphasizing the point the clothes don't make the man or the show. The content should. But what about the woman? Our female colleagues get messages on a regular basis about what they're wearing. Some nice, but not usually. One specific message recently gave meteorologist Bree Eggers some inspiration, who some of you noticed wore the same dress every day for 2 weeks. Why? And why does it matter? Here's Bree to explain.
A few years ago, I saw a story about a male anchor in Australia who wore the same suit for an entire year and no one noticed. No one noticed his repeat suit because most viewers were too busy picking apart his female co-anchor's outfits. Since then, I've wondered what would happen if a woman tried the same experiment. I get questions all the time. How is it that you never wear the same thing twice? My little secret is I've been renting my clothing for the past 7 years. It's fun and it's new every day and I don't have to shop or try things on, but it is fairly expensive. About a month ago, I received feedback from a local viewer who said my, quote, apparel was so unattractive and distracting that she misses the forecast completely. And I thought maybe the fashion part of the job is detracting from my job itself. Honestly, comments about my wardrobe distract me as well, and I just wanted to see what would happen if I put all of the focus on the forecast. So I wore this same $17 black dress for 10 days straight, and I saved about $200 by not renting dresses, and it was so much easier to get ready every day. Viewers noticed right away a couple of "am I going crazy?" comments on day 2 and 3, and then several more questions as the days went on. But what I didn't get in those 10 days was criticism of my wardrobe. No negative comments at all. It was an interesting experiment. I only made it 10 days before I was asked to change. The anchor in Australia, he made it a full year. And I need to say, this is not about the rude comments or the trolls. I know haters gonna hate, and I just shake it off. But I've been told in my many years in this business to grow a thicker skin, and this dress was kind of that for me. It felt empowering to not think about how I looked or what people were going to say about my body shape or clothing, and just focus on the forecast.
I don't have anything to say about that, Bree, other than I am thrilled that you did it.
I put on a blazer today. I just want to say that it's not Bree Eggers' stink gate. I did wash the dress, and it is a $17 dress that does not wrinkle. So if you do see me wearing this dress again, which I intend on wearing it as often as I'm allowed to, consider it a bit of my armor or perhaps just my work uniform.
Well, and as you mentioned, it shouldn't be about what we wear or don't wear when we bring you the news and the weather. It's about the content, right?
Yeah.
It's about what we're trying to tell you every day.
Exactly, and my point is not to give credit to anybody who did send in comments. You know, I can get past that part. I can grow a thicker skin. I have in this business. You have Brian. We talk about this as well. But what's important is the message that we're trying to give and the content, as you mentioned before. And so really, I just wanted to take a moment and see what would happen if I focused on the forecast. So let's do that.
And well, really quickly, I like the juxtaposition you showed with the Australian anchor.
Yeah.
Nobody said anything about his suit. But you could see all the changes in his co-anchor's attire, and as you said, everybody had something to say about that.
Time and a place for a fashion show, Brian.
Exactly.
Can't wait to see what your tie looks like tonight.
Well, thank you very much for doing that, Bree.
Yeah, thank you. Thank you for allowing me to share that message. So the 7-day forecast, not a whole lot of changes, even though we've changed the month. I have not changed my dress. I intend to next week, though. We do have a bit of a cool down as we head into the middle of the week, and there is a slight chance for a few flurries. Maybe you saw a few of those few and far between flakes today. A light breeze on Friday makes it feel even chillier and perhaps even a bit of a temperature inversion that sets up this weekend, but it won't stick around for too long. You can always find the freshest forecast at ktvb.com.
Our final moments of the show. Let's get to some of the comments you sent in during today's show. The same question prevails every day in Idaho, says Steve. There are people who care about their fellow citizens, and there are others who only care about themselves. This is, of course, in relation to what Representative Carrie Hanks was talking about trying to pass a no mask mandate throughout the state of Idaho from any government entity passing that around the state. St. Anthony is part of the Rexburg area. During the 1918 Spanish flu, the Rexburg City Council saw the wisdom of closing the schools and requiring masks, says Dave in Boise. Aren't we supposed to get smarter over the years? It's a very good question. So yeah, a lot of things happened in 1918 that people tend to forget. We went through this situation before when it comes to regulations and what it means to care about each other and to do things to stop the spread of a deadly disease. People dying in the streets, really? That's quite a reasonable benchmark for mask wearing. Oh my goodness, says Peggy in McCall. It just blows my mind to hear politicians proclaiming body autonomy to COVID, but deny women the same respect, says Paul. We got a couple of those today. Yes, noticing the hypocrisy, or as you want to put it, I guess, about that body autonomy, about being able to choose what we want to do with our bodies and then trying to take that away from women here in Idaho. Madam Legislator should explain why we have to wear shirts and pants. God gave us a lot of parts. He intended us to be wise with them, says Tam. A lot of things should remain covered, by the way. I surely don't watch a 2-8 for what you wear. Everyone, keep up the good work. Go Bree. Go Bree. See you back here tomorrow.